So anal canal is 38 millimeter long, starts 2 to 3 centimeter below the tip of coccyx, ends at 4 centimeter below the tip of coccyx. Its parts are 3. The upper 15 millimeters is called as mucosal parts. That mucosal part has anal columns. The corner columns are lower, united with each other by anal valves. Above each valve is anal sinus. Inside each sinus there is anal gland. So anal columns, anal valves, anal sinus, anal gland. Hard stool formation happens. Everything cannot be blamed on non-veg. Things have to be blamed on maida also. Suddenly मूड में आके अपने पार्ले जी का वो किसने लोगों को वो चाय में ऐसे डुबो के फिर उसका कितने लोग पेस्ट करके खाते हैं, पेस्ट करने का उसका या दूध में बिस्किट ऐसे डाल के डुबो के, हाथ ऊपर करो, शर्माओ मत, 1 2 3 ओरियो हाँ बस so any other thing, even white bread, MACD is supporter. So that hard stool formation can break one of these valves as the stool is coming out and tear the mucosa in this part. That is called a fissure. आपने सुना रहेगा anal fissure. So and the hard stool tearing the mucosa. So this is upper 15 millimeters, which is mucous part. Next 15 millimeters is the pectinate part, which has some venous sinuses below the mucosa. These venous sinuses below the mucosa are drained by veins at 3 position, 3 o'clock position, 7 o'clock position and 11 o'clock position. Normally these veins are not visible. But when they are enlarged because of straining, this leads to what is called as piles. त्याला पण एअरप्लेनला टाकतो. Okay. Now strain on the veins causes enlargement of the veins. There are few combinations. Like, for example, the conductor who is standing in the bus, his veins of the lower limb are under continuous strain, so he gets varicosities of the lower limb. And the driver who is sitting, he can get varicosities of the anal canal. Okay, there is continuous sitting pressure. The surgeon who is operating, standing for hours together, can get varicosities of lower limb. Anesthetist who is sitting there और दोस्तों ने कैसा है, तो क्या कर रहे हैं आजकल, बच्चे कितने बड़े हो गए, बीबी क्या कर रही है, वो चैटिंग कर रही है. Continuous sitting is not good. Of course, that is just on a lighter note I am telling you. Okay? Because continuous sitting also reduce, bowel movements भी हमारे slow down होते हैं. जितना आप चलोगे, आपने देखा चलते तो भूख लगते, नहीं चलते. Person gets constipated also. Anesthetics. Teacher who is standing and teaching the students susceptible to varicosities of lower legs. Students keep on sitting from 8 o'clock till 12 o'clock. Three of this varicosities of anal canal. Wife who is cooking in the kitchen morning for 2 hours, 3 hours can get varicosities of lower leg. Husband who is sitting in the hall, झालं का हो गया खाना रेडी हो गया ऐसे बैठे बैठे he can get this varicosities. So basically the principle is don't stand continuously, don't sit continuously, be mobile. Be mobile, you don't get varicosities of lower limb. Be mobile, your bowel, you move, your bowels also move. Movements also are good and don't get varicosities of, and of course good fiber to move the bowels is very important. Thank you. Pectinate part. And last part, the last part is cutaneous part. Last part is cutaneous part. यहाँ पे एक्चुअली हेयर फॉलिकल्स होते हैं. हेयर फॉलिकल्स होते हैं. There are hair follicles over here. There are sweat glands over here. And that is the problem. That is a problem. See, on the sides here, you know there is ischioanal fossa. There is ischioanal fossa. Okay? Here is fat. Here is fat. Here is fat. Here is fat. So on the sides of the anal canal there is fat that keeps the anal canal collapsed. So that when stool passes, the stool can just push the fat pockets, the ischioanal fats of fat, and then stool is passed and again it collapses. Now the problem with fat means fat is here also around the anal opening. Problem with fat is that fat means less blood supply. Less blood supply means less RBCs, less WBCs, mainly less WBCs, less lymphocytes, less protection. Now here I am talking about this terminal portion. There are hair follicles. One of the hair follicle, gets infected. There is no enough blood supply if a person is continuously sitting. Very common problem with office goers, very common problem of prolonged sit in libraries also. Because see, if you push your finger like this, it turns white, blood supply is reduced. Now here is all fat, and if this pressure is everything on this point, so less blood supply. Less blood supply then prone to infections. And here the hygiene is also not kept properly. We had one doctor, his surname was doctor. ऐसे हमारे टीचर थे. So doctor बोलते थे हम उनको. He used to tell that when you were small, your mother used to clean this with soap. Nowadays people just press and they walk out. And then they get some irritation. So this cleaning has to be very thoroughly done, which people don't do. And then they sit for prolonged hours. And then that can lead to reduced blood supply. Reduced blood supply means this area is susceptible to infection. So lower end of the anal canal, why people get fissures or fistulas, piles, is because of piles, of course, is more due to straining, but the abscess, perianal abscess, is more common due to prolonged sitting. मामा को इधर से आवाज दी और उसको पूछ सर आए हैं क्या. 9:30 से 10:30 है ना सर का. तू देखने को मत जा. तुझे झालं का नाही. Now this line where mucosal part ends is called as pectinate line. This is the watershed line of the anal canal. Watershed line means iske above the blood supply is by the blood is drained into portal veins, below it is drained into IVC. Ultimately, so site of portocaval anastomosis. तू ये रे बाबा, तू जाऊ नकोस ना, तू मत जा रे, मुझे तेरे को सिखाने का. So this is the watershed line. Above this, supplied by sympathetics, parasympathetics, autonomic. Below this, supplied by sensory nerves. So what happens is, bleeding हो रहा है. आप पूछते हैं painless, painful. Painless means above the pectinate line. Painful means below the pectinate line. Above pectinate line, it is just susceptible to distension but not pain. Pain means the lesion is numera, lesion is below the pectinate line. Okay? This line where the pectinate part ends is called as Hilton's line. It's called as Hilton's line. This is where the internal anal sphincter ends. Internal anal sphincter is under the control of the parasympathetic nervous system and sympathetic. Sympathetic keeps it constricted, parasympathetic relaxes it. The external anal sphincter is like this. External anal sphincter is like this. Okay? So it goes below the internal because external is under our voluntary control. So even if internal relaxes and the stool comes here, external can still constrict and contract and prevent the stool from coming out. Okay? Applied anatomy. The blood supply, I have already told while talking about the pectinate line. Lymphatic drainage also is into internal iliac, and below this is superficial inguinal lymph node. So patient comes to you with superficial inguinal lymph nodes enlarged. Check whether there is anal canal infection. आप बोलिए इधर है क्या? इधर है, कुछ गड़बड़, no. Whether there is any sexually transmitted disease, ये वो आप देख रहे हो सब ठीक है. Check the anal canal also. The perineum drains into superficial inguinal lymph nodes. We only may keep on looking at the lower limb. We may keep on looking at the genitals of the patient, whether there is any lesion. But we may miss upon the anal canal which also drains. Okay? Then there is ischioanal pad of fat. Okay? यहाँ पे भी है ischioanal pad of fat. Here is perianal pad of fat. Perianal pad of fat. Applied anatomy 1. Congenital anomalies. Imperforate anus. Imperforate anus. The anal membrane does not, break down towards the end of the pregnancy. It has completely break down. So a doctor is actually relaxed when the बच्चों passes to. उसके बाद वो रिलैक्स होते, सांस लिया, रोया, that is not that. Okay? He has to pass stool also, that imperforate area. So when the child is born, the first thing the doctor may do, tap and he cries. So he cries, he is alive. But for a doctor, then he has to drink milk. If he drinks milk and he does not cough, drink milk, then there is a TOF, tracheoesophageal fistula. He drinks milk and then does projectile vomiting in congenital pyloric stenosis. congenital pyloric stenosis. So much thing. So doctor has to wait till he passes stool. He's not passing stool. Then there is imperforate anus. So it's not that what they show in the movies, they come out and say, सब अच्छा है, बच्चा लड़का हो गया, लड़की हो गया, जो भी. No, stool pass करने दो, उसके बाद मैं बोलता हूँ कि अच्छा है कि नहीं. Okay, we have to wait and we have to observe. We have to observe the child till that point. Okay. Then 2 investigations. Investigation per rectal examination, proctoscopy remains same. Okay. 3 medical problems. And here medical problems ऐसा कुछ, that proctitis also may happen. Surgical problems are 3. 1, 2, 3. शाह किसका सरनेम है इधर? हाथों पर तो और ठीक, बस पहले जब रेलवे में ना ये लगाते थे, छोटे छोटे एडवर्टाइज लगाते थे, चिपका के जाते थे. आई एम टॉकिंग अबाउट 20 years बैक. दैट डॉक्टर शाह में नॉट बी देयर इन दिस वर्ल्ड ऑल्सो. सो उसका एक रहता था शाह पाइल्स क्लिनिक. ही वाज सर्जन, वेरी फेमस सर्जन इन द सबर्ब्स. So they survived only on 3 things. 3 surgical anatomy: piles, fissure, fistula. Piles, fissure, fistula. So what is fistula? See, this ischioanal fossa, यहाँ पे infection हो गया. That infection spreads here. Okay? That infection opens here. Suppose यहाँ का एक hair follicle is infected. So abscess happens here, then abscess opens here. So now after few days stool comes and starts passing out from here. That is fistula. Oh, very difficult to heal because उसमें से stool आ रहा है यार. Heal कैसे होगा? Fissure is when this breaks. Piles is when these veins enlarge. God आपके सामने आता है, बोलते तुमने बहुत पाप किए. बहुत important. God comes in front of you and says that you have sinned a lot. So I give you only 3 options: piles, fissure, or fistula. Choose one. How many of you will choose piles? Okay. No, nota is not allowed. Huh? Fissure, fistula. जो लोग ने हाथ ऊपर नहीं किया उनको तीनों हो सकता है. So that case best is God, if तीनों में से एक I have to get fissure, because fissure heals. It heals. Take antibiotic, take a stool softener, take seeds bath. You know what is seeds bath? Sitting in warm water with potassium permanganate, so it heals. Piles, एक बार हो गया, veins dilated, they come out, they need to be banded and they have to be operated. And fistula, where the stool is coming out like this, the stool, a fistula is created like this, very difficult. So worst thing is fistula. So read anatomy before God asks you what you want. Like 1 second, can I call Dr YJB? Phone a friend and I'll tell you what is to be done. Okay, thank you. So the last is anal cancer, of course. It's all over. So we are summarizing the anal canal. Anal canal is 38 millimeter long, 3.8 centimeter. It starts 2 to 3 centimeter below the tip of the coccyx and ends 4 centimeter below the tip of the coccyx. Functionally, it has 3 parts: upper 15 millimeters, middle 15 millimeters, lower 8 millimeters. Upper 15, it's upper 15 is mucous part where there are anal columns, there are anal valves. And above each valve there is sinus and there is anal gland. The next is pectinate part. Mucous part, pectinate part, there is Then there are veins here. These veins are organized at 3 positions, 3 o'clock position, 7 o'clock position and 11 o'clock position, which are not seen. Only when they are strained and dilated, it happens like this. Okay? Also. Then the next is the cutaneous part. Cutaneous part has a proper skin. So mucous part, pectin part, cutaneous part. Anal sphincters are internal anal sphincter which ends at the Hilton's line where the pectinate part ends. External anal sphincter goes lower down. It is under our voluntary control. This pectinate line, which is where the anal valves are there, between the mucous and pectinate part is the watershed line. Above this, the nerve supply is by autonomic. Below this is by the regular sensory nerves. So painless lesions above, painful lesions below the pectinate line. Then the lymphatic drainage above into internal iliac, below into superficial inguinal lymph node. Venous lymphatic drainage. Venous drainage above into superior rectal vein, below into middle and inferior rectal vein. Artery is also same. Superior rectal artery, middle and inferior rectal artery. The applied anatomy of the anal canal. First, congenital anomalies in for anus. Investigation for rectal examination by finger or proctoscopy. Medical problems are like proctitis may just come down. Otherwise, surgically 3 main problems you have to remember. Piles, dilatation of these veins, fissure where mucosa is cut, and fistula where infection into goes via ischioanal sinus into the anal canal and a tract is formed which is opening separately than the anal opening. So stool is coming out of anal opening and also from here. And last, the anal cancer. Okay, thank you. So yeah, now as regards the further sessions, next week is concerned, I had planned whether we can have upper limb revision, lower limb revision in the morning. That all, okay.